Welcome to Piedmont Transplant Institute. I'm Dr. Christina Klein, a transplant nephrologist and the medical director of kidney pancreas transplant here at Piedmont. We are so grateful that you have chosen Piedmont for your transplant evaluation today. Here at Piedmont, we are extremely proud to have successfully performed thousands of kidney transplants, with approximately 1/3 coming from living donors. We understand that you have several questions about transplant and whether or not it is the right treatment for you. We want to make sure that you feel educated and fully informed throughout this entire process.
Hey, Connie.
Hi.
How you doing today?
Our kidney transplant program is dedicated to giving people with kidney failure a second chance. Every member of our exceptional team is here to help. We are a highly trained and compassionate group of professionals who will be right by your side, taking care of you during this journey. In this video presentation and during your evaluation visit, we want to make sure you have all the information you need to decide whether transplant is the best option for treating your kidney disease. Today, we'll talk about the benefits and the risks of kidney transplant. We'll describe the different stages of the transplant process, and most importantly, we'll tell you what you can do to achieve a successful transplant. The first thing to know is that transplant is a treatment, not a cure, just like dialysis. It's possible that after your evaluation, you and our team will determine that dialysis is the better treatment for you. So what happens in a kidney transplant? When you get a kidney transplant, a healthy kidney from a donor is surgically placed inside your body. Your own kidneys usually remain in place. Your transplanted kidney can come from a deceased donor or from a living donor who donates one of their 2 kidneys.
Thank you for your gift. I cherish it. Your kidney works so well.
We will discuss these 2 types of donors later in this video. First, let's talk about the benefits and the risks of kidney transplantation. There are several potential benefits of a kidney transplant. First, a longer and improved quality of life, the ability to resume work, easier travel, fewer dietary restrictions, improved fertility for women of childbearing years. There are risks associated with transplant surgery. Before you consent for a transplant evaluation, it's important that you know about these risks. Similar to other abdominal surgery, risks of the transplant operation include infection, bleeding, reaction to anesthesia, potential need for repeat surgery, blood clots in the legs, and rarely death. After surgery, there are also potential risks of the medications that you must take after transplant called immunosuppression. Since a kidney transplant comes from another person, your immune system will try to attack the kidney. This is called rejection and can cause the transplant to fail.
Every transplant patient gets this little kit.
To prevent rejection from happening, transplant patients must take immunosuppression medications daily for as long as the transplant functions. The immunosuppression drugs themselves have side effects and risks. It makes sense. We must suppress your immune system to keep your body from rejecting your new kidney, but that can leave you susceptible to things that your immune system naturally protects you from. This includes infections and cancers. People must be infection and cancer-free to be put on immunosuppression safely. Each of the medications also can have certain side effects. As you can see, there's a lot to consider. Our transplant team is going to work closely with you and your loved ones to help determine whether or not transplant will be the best treatment option for you.
It is a lot, but if you look at what the benefit is rather than looking at what you have to do and you incorporate it into your life, I will be very compliant, take care of myself, because that is a true gift, and I have a second chance at life, and I'm not going to squander it.
Hello, I'm Dr. Clark Insinger. I'm one of the transplant surgeons at Piedmont. So that we can determine if getting a kidney transplant will allow you to live longer and allow a better quality of life, you'll need to undergo an in-depth medical evaluation. We do know that to benefit from a transplant, you must be healthy enough to undergo surgery and recover from it, be able to take immunosuppression, which means being free of cancer and infection, have well-controlled conditions like diabetes or heart disease so that a new kidney stays healthy, have healthy blood vessels, and a safe wait for surgery. Just as important as those health factors, we'll need to make sure that you have the appropriate resources and support to take care of your kidney after transplant.
My man, there you go. How you doing? Good.
Pursuing a kidney transplant means you are making a real commitment to partner with our team and our transplant center for a lifelong relationship. Unlike kidney dialysis centers, which are in many locations all over the state, the number of transplant centers is very limited. You'll need to come many times to our clinic in Atlanta for lab tests and other checkups so that we can make sure you don't have any rejection or infection. It's an average of 12 trips here in the first 3 months after a transplant and then periodically after that time. You'll need a reliable person to drive you to your appointments, especially in the weeks right after your transplant. It's also very important that you are able to obtain all of your medications and to take them according to instructions. And of course, there are costs associated with the transplant. That's another consideration our team will help you explore today as part of your evaluation. Again, we're not only here to determine if you're medically right for transplant, we're also here to help you determine if you can make the commitment to the follow-up care that's needed to make a transplant successful.
Oh, I love the Piedmont team. They're great. You know, they take care of me every time I come in, from the front desk people to my nurse and all the other doctors that see me. It's awesome.
Hi, I'm Adam Charnett, Transplant Coordinator at Piedmont Kidney Transplant Program. I will be talking to you about our transplant evaluation process that you'll be undergoing today. Again, the first step is to determine if kidney transplant is medically the right treatment for you. And just as important, we will determine if you have the social support and resources to commit with everything a transplant requires.
Today is your evaluation visit. You'll get a lot of information today.
As part of your first consult with our clinic, you'll be meeting several members of our team. One is a transplant coordinator who'll talk to you in general about what kidney transplant involves and answer some common questions. Another person you'll meet is a kidney doctor who specializes in kidney transplant. They'll review your medical history and do a physical exam. You're going to undergo a series of medical tests that will determine if you're healthy enough for a transplant. These tests include lab tests for infections and a drug screen, an electrocardiogram to check your heart, a chest x-ray to check for lung disease, kidney ultrasound to make sure there's no cancer, and a CT scan of your abdomen and pelvis to make sure your arteries and veins are healthy enough to surgically attach a new kidney. And perhaps most important, you'll meet individually with a transplant social worker. A successful transplant will take a lot of work from you. It's very different than dialysis. As opposed to dialysis clinics, which are located all over the state, there are only 3 kidney transplant centers in Georgia.
If you could stand on the scale right here to the left for me.
You will need to be able to come to our transplant clinics regularly and take transplant medications every single day. Planning for this will take work on your part. Care for the first several months after transplant must be at our transplant hospital. You must plan for how you'll get to your clinic visits at Piedmont. This includes identifying a support person to bring you right after surgery when you cannot drive. The social worker will also talk to you about the need to financially plan for a transplant. Transplant medicines are specialty medicines and can be expensive. We will let you know about any financial assistance programs that may help with the medications.
Medicare Part B pays 80% of your immunosuppressant medications.
Many private and state insurers have some coverage for transplants as well. You may even decide to put away money to be prepared for transplant. After your transplant evaluation, all your medical tests and consultations will be reviewed in our Transplant Selection Committee to determine whether transplant is the best option for you.
The toughest part of being on the transplant waiting list is, honestly, the wait. It just puts your life on hold while you are waiting for a kidney. They told me it was going to be 3 to 5 year waiting list. I was fortunate enough that I got my call after only 13 months.
Hi, I'm Danny Collado, a nurse and a kidney transplant waitlist coordinator. I'm going to talk to you about what it means to be on the kidney transplant waitlist. Within 2 to 3 weeks of your transplant evaluation, our kidney transplant committee will review all of your test results and will let you and your doctor know if you are approved for placement on the waiting list. The committee could also decide that you need additional tests before you can be approved, or that the risk of you getting a transplant are far greater than any benefit you would receive. Some people may not be eligible for a transplant right now, but might become eligible in the future with improvements in certain health conditions. If you're healthy enough to undergo a kidney transplant, have additional resources, can commit to taking the transplant medication, as well as come to Piedmont for your transplant follow-up care, you will be placed on the kidney transplant waitlist. Please remember, just because you're placed on the kidney transplant waitlist does not mean you will definitely receive a transplant. Here's why. The number of candidates waiting for a kidney transplant is much larger than the number of available kidneys. In fact, only about 15% of people waiting in the US are transplanted each year. Also, you need to know that older people and those with multiple health problems can sometimes become too sick for a transplant the longer they wait on the list. So at any point we think you become too sick to transplant, we would have to remove you from the list. Understandably, everyone wants to know how long they have to wait for a kidney transplant. There is no way to accurately predict how long it will take for you to receive a deceased donor transplant. To be honest, it could be years. The main factors affecting waiting times are how many people are added to the wait list each year, and how many kidneys are donated in our area. Waiting times in our region can be longer than in other areas because there's a lot of end-stage kidney disease here. Another factor is how long you've been on dialysis. Also, your blood type. Blood types O and B wait for a transplant much longer than blood types A and AB. And the national organ allocation rules are also a factor. For example, children and younger candidates without diabetes have a shorter wait time. The most successful way to increase your chance for a kidney transplant is to find a living donor to donate a kidney. While you're on the Piedmont wait list, you will return to the clinic every 1 to 2 years for your reevaluation visit. And every month while you wait, you will get blood work done at your dialysis clinic or doctor's office, and it will be sent to our transplant lab. During the time you're waiting for a donor kidney, it is critical you stay prepared for a transplant. That means let your waitlist coordinator know if you change your insurance, change your phone number, or if you move. Most importantly, we have to be able to reach you. If we cannot contact you within an hour of a kidney becoming available, we are required to move to the next eligible patient. You can stay prepared by being as healthy as possible. You need to stay active and exercise, do your dialysis and take your medications as prescribed, eat a healthy diet, including a phosphorus restriction, and keep all conditions like diabetes and high blood pressure under control. And make sure your vaccinations are up to date. So apart from staying prepared and healthy while you wait, there are other things you can do to improve your chances of getting a kidney transplant. If you're older and diabetic, you may benefit from consenting for specific kinds of deceased donor kidneys. You might be eligible for one of our research programs here at Piedmont Transplant Institute. Or you may want to multi-list, which means getting placed on the waiting list at more than one transplant center. But again, the most successful way to increase your chance for a kidney transplant is to find a living donor to donate a kidney directly to you or through the paired exchange. How can you find a living donor? Well, we have several tips on our website, piedmontlivingdonor.org. But many transplant recipients find their living donor by sharing their stories and asking their friends and family to become their living donor champion.
My donor is my wife. I was lucky in that way, obviously.
We went through the process of my blood work and evaluation. My coordinator, Leanne, got a hold of me and said, "You're a match." I couldn't breathe. I couldn't talk. All I could do was cry.
Hi, my name is Dr. Josh Wolf, and I'm a transplant nephrologist here at Piedmont Transplant Institute. Today I'm going to talk about living kidney donation, its process, and the advantages involved with this. There are many benefits to a living donor transplant. Living donor kidneys last longer, an average of 12 to 15 years compared to 8 to 10 years for a deceased donor kidney. You will have a shorter time to transplant with a living donor and may even be able to avoid dialysis if you aren't yet on dialysis. Because it's a planned procedure, you'll have time to prepare your support system, finances, and time off work. With a living donor, there are also lower rejection rates, shorter hospital stays, and fewer complications. Who can be your kidney donor? It could be someone you know, like parents, spouses, siblings, adult-aged children, other relatives, friends, and coworkers. Your donor could also be someone you don't know, someone who hears about your need and volunteers.
I was on the waiting list for nearly 4 years, And I finally got a kidney from someone I knew. It means the world, like someone would actually give a piece of their body to me or anybody else.
The biggest barrier to finding a potential living donor is to be comfortable with disclosing the fact that you have kidney disease. Once you do that, it is really important to educate those that are interested in being potential donors to you. First, you can let people know that living donation is safe. We are not going to allow someone to donate their kidney unless we feel that they can live the rest of their life with one kidney and do okay. Second, you can let them know that your insurance will pay for the potential donor's evaluation, transplant surgery, and follow-up care with us afterwards. The surgery is now minimally invasive. It's done laparoscopically, so oftentimes the donors are going home the day after surgery, and within 4 to 6 weeks, they're back doing everything they did before they donated. Besides a face-to-face conversation, social media has a lot of powerful presence. For instance, I would encourage you to create a Facebook or Instagram page telling others about yourself, your current situation, and how a living donor can not only improve your quality of life, but can also add years to your life.
It just got to the point to where, you know, continue to wait. Years went by, another year. And I was like, okay, I have to help myself before I expect somebody else to help me. So I just had to put it out there, you know, with the video, Facebook posts, Twitter posts, and I created the website, weneedakidney.org.
At the end of your post, please let others know that even if they find that they cannot be a donor to you, they can still help you by sharing your post on their feed. That way your message gets sent out to others exponentially. Oftentimes, donors will come forward that don't even know they're recipients but learned about them through a mutual friend's post. In addition, we have several tips for finding a living donor on our website, PiedmontLivingDonor.org. Once you find a potential living donor, there are 2 ways that they can contact us. One is that they can call the recipient coordinator whose card you will receive today. The other is that they can go on our website and fill out one of our living donor questionnaires, and one of our living donor coordinators will then call them. The potential living donor will undergo several lab tests and other medical evaluations to determine if they are blood type compatible and an immunologic match. If you're not a match with your donor, don't be discouraged. 1/3 of people are not a match. Here at Piedmont, we've done hundreds of successful transplants through the Paired Kidney Exchange program. Whether you're waiting for a kidney on our deceased donor waiting list, or you've identified a donor directly or through our Kidney Paired Exchange program, when it comes time for your transplant surgery, you will be under excellent care with our multidisciplinary team on our designated transplant unit here at Piedmont.
It was one of the best phone calls that I ever received. They said, okay, you need to be ready in a couple of hours and we'll see you at the hospital.
They took us both back to prep, and they brought her by to see me, and they took her in about half an hour, 20 minutes before me, and then they took me back, and they take the kidney from her and pretty much pass it on and put it in me.
The next thing I knew, I woke up in my room. We were next door to each other. And as soon as I was allowed to get up, I went to go see him to make sure that he was okay, to give him a kiss. So we did it. We did it.
My name is Dr. Emmanuel Minja. I'm an abdominal transplant surgeon here at Piedmont, Atlanta. My passion here is really kidney transplantation, including deceased donors and living donors. Today I would like to share with you some information regarding the transplantation surgery itself. So one of the things that I want to really emphasize is what has been mentioned before. That is, for you to have the best outcome with regards to transplantation, preparation is key. If you have a living donor, we will see you for a preoperative visit within 2 weeks of your surgery. If you are, however, waiting for a deceased donor transplantation, remember that those organ offers, they can come at any point of the day. It can be at day, it can be at night. So that's why it's important for your coordinators to have all your contact information so that they can reach you at any time. So this is a preoperative area. This is where you would be before the surgery. This is where you'll meet our anesthesia team. This is where we're gonna also meet with you just before going into surgery, ask if you have any last minute questions that have not been addressed before. And once we are ready to roll, this is gonna be the pathway that we're gonna be taking to go to the operating rooms, and that's where we start the surgeries. The transplant surgery usually takes about 2 to 4 hours. You will be under anesthesia during this time of surgery, which means you will be completely asleep. A catheter is going to be placed into your bladder so that we can drain and monitor how much urine you're making. A special intravenous catheter is going to be placed in your neck vein, and that catheter is going to allow us to give you the powerful immunosuppression medications during surgery, and also allows us to monitor you during the surgery process itself. Once you're ready for surgery, we will make an incision in your lower abdomen. We do not remove your own native kidneys. We go into a space where we have blood vessels that go towards your leg, and we connect the kidneys' blood vessels to those blood vessels. Once the transplantation surgery is complete, the incision will be closed either using staples or using glue. Once you're out of the operating room, you will be in the recovery area. This is the post-anesthesia care unit, where we'll monitor you closely to make sure that all your vital signs are stable and the kidney is continuing to do well before we send you to the transplant floor. Following completion of the transplant surgery, we'll come and update your family and let them know how everything went with the surgery itself. After you're awake and have recovered well in the post-anesthesia care unit, you will be transported to the transplant unit, and how long you're going to stay in the hospital usually lasts for about 3 to 5 days. During the recovery time, while you're in the transplant unit, you will be getting intravenous immunosuppression medications to protect the new kidney so that you do not develop rejection. All surgeries have risks and potential complications. For the kidney transplant surgery, especially for deceased donors, there are times where the kidney might not start working right away. We might need to support you by continuing dialysis while you're in the recovery phase. If this happens, it may not delay your discharge from the hospital because you could return to your local dialysis clinic. There's also a risk for infections after transplantation, and we will talk more about this later. Less than 5% of the transplants that we perform experience rejection, and that speaks to the amount of care that's taken during, before, and even after your transplantation to make sure that you have the best outcome. Here at Piedmont Atlanta, we've had the privilege to really take care of hundreds of both living and deceased donor transplants with excellent outcomes. And we are really looking forward to the opportunity to walk with you in this journey and into kidney recovery.
We live in Murphy, North Carolina, and that's about 2.5 hours away. So once we got to where they only needed to see me weekly, we would drive in and early in the morning, or occasionally we'd come down the night before. Just depends on how I felt. And we did that for, a month. But you do what you got to do.
Hello, my name is Christy Goldberg. I'm a post-kidney transplant coordinator here at Piedmont Hospital Atlanta. Let's talk a little bit about what you can expect after you have your kidney transplant. The first thing I'll tell you may not believe, the surgery itself is actually the easiest part of your transplant experience. It's true, the real challenges can come with the strong commitment you have to make to your long-term follow-up care. This is the only way your new kidney will last for years. You also have to be prepared for potential complications along the way. The average hospital stay after a kidney transplant is about 4 days, but it could be longer if complications arise. For example, your kidney may take time to fully work. You might need dialysis until the kidney function improves. Other complications include rejection and issues with wound healing. The most common cause of infection is viral and bacterial. This can happen in up to 50% of all patients within the first year of transplant. Most complications are treatable and do not cause the new kidney to fail. But some of these potential problems could mean that you have to be readmitted to the hospital.
I was healing up well, and then ended up with an infection in the incision. They wanted it to heal properly and slowly, so I'm on a wound vac machine. It pulls the skin together over time. It's changed twice a week, and once the skin pulls together, I'm good, I'm healed, and ready to rock and roll. But the kidney part aspect of it, I'm doing great. Absolutely fine.
You and your family need to be prepared for these complications and have a plan in place. The best way for us to treat any complications is to be able to detect them early. That means that we're going to be seeing a lot of you over the first few months. After discharge from the hospital, you'll return to the transplant clinic within 3 to 4 days for your first clinic visit. You must have someone who can drive you to your follow-up visits because you won't be able to drive for several weeks after your surgery. For the first 3 months post-transplant, you'll be required to come to the Atlanta clinic approximately 12 times. This will include office visits with the doctor and lab visits. The reason is you're going to have frequent lab tests to make sure you don't have any infection or rejection. Labs are the only way to confirm that your kidney is healthy and to check for some viral infections. We also have to make sure you are on the correct doses of your anti-rejection medications. A major cause of transplant failure is not taking medications correctly. We want to make sure you are on the right medications at the right doses.
This is my life. It's not a burden at all. This is my second chance at life. So I make sure that I follow my routine very closely every day.
For the first 6 months after your transplant, we will provide all of your kidney care here at Piedmont Atlanta. After the 6 months and for as long as your transplant functions, you'll be seen by your local kidney doctor and primary care physicians. However, we will continue to see you as long as your transplant functions. If you live outside of the metro Atlanta area, after 6 months we can see you at one of the several satellite clinic locations that we offer around Georgia. Remember, transplant is a treatment, not a cure, so you need to be committed to a full lifetime partnership with our team to have a successful transplant. Wishing you all the best in your journey ahead.
I've been great. The transplant is almost 4 years old, and I'm healthier than I have been in a long time.
To be able to give someone so important to me the opportunity to have more years and to be healthy again has just been amazing.
Getting a kidney is just been life-changing, you know. I won't forget it, and I definitely won't forget my donor. It's just like he saved my life.
On behalf of our entire team, we want to thank you for choosing Piedmont Transplant Institute to explore whether or not kidney transplant is the correct treatment for you. We will be with you throughout this journey, answering your questions and providing excellent care along the way. You can also find the information covered today in our Kidney Transplantation Handbook. Please take the time to review this booklet once you return home. From all of us, we look forward to meeting you during your evaluation visit.